So students, we're going to do a little sidetrack here from mechanical ventilation to non-invasive mechanical ventilation. And here we're looking at the Philips Respironics V60, the NIV, non-invasive ventilator that is quite often used before intubating a patient. This is hopefully the one way that we would be able to prevent intubation. But anyhow, I'm going to go through this ventilator here real quick, and as you can see, I'm looking at the circuit, and the circuit, it is a single line circuit. It does have a bacteria filter on it, so that will always be on there. It is removable. You just find a new one for each patient. There is a pressure line here that take it off. So you have a pressure line right here that measures pressure at the end of the circuit, and a single line circuit. I'm going to plug in the pressure line, plug in the circuit here. Okay. There is also on this ventilator down here, you can see a Fisher-Paykel humidifier. So if we were going to be using the humidifier, we'd use that corrugated tubing here. And we would connect it to the bacteria filter, and we would connect the single circuit power source, power hose, to the BiPAP circuit. Okay, so that's how it would set up, but most likely will not be using that external heater. That's if they're going to be on it, BiPAP or NIV for a long time, they might use that to provide proper humidification. But we're going to disconnect this here, and we're going to go directly to the bacteria filter. Okay, so the circuit, you can see we're going to follow through. It goes all the way to the end, and we have here, this will connect to the interface, the mask that we will be using on the patient. This does have, so this is the pressure line right here. It's measuring pressure right at the mask, and there is also an opening right here where my thumb is. This is kind of there's a constant exhalation. This is an exhalation port. This is where pressure is constantly being released right there. So that is kind of like the exhalation right there, okay? So we will go ahead and turn on this NIV here and show you exactly what we need to do, okay? So the interface, and in the PowerPoint, it'll show you different ways of using the interface. This one is a full face mask. It actually covers the nose and the mouth. And generally when you are starting out with a new patient, there is a template in the mask kit, or something in there, either a card or something that you will measure the correct placement of the mask. Make sure you get the right size. And generally they're measuring from the bridge of the nose right here, not all the way up to the top, but the bridge of the nose down to underneath the lip. And by using that little stencil, it'll tell you what size mask that you would use. This one here is a large mask, okay? And this is a Respironics, I believe it's Respironics, but anyhow, it has a L on it telling you it's large. There's some other identifiers on this mask also. On the front here, right where the swivel is, is a number. This is a number 1. This is on the V60. You will go ahead and select number 1 for the mask when we go in there. I'll show you how to do that. This mask here has a quick disconnect. You pinch the outside pins here, you pinch it and it comes off, okay? And it could connect quickly, so that's, we need to remove the circuit right away, we can do that. It does have little hooks here, and up here it's Velcro, and that's secured up there. It also has a button up here that allows it fine adjustment for moving it towards the forehead or away from the forehead and closer to the mask, okay? So these are all fine tuning, fine adjustments that you can do. A lot of Velcro on the straps here, on the sides here, also around the head, the cap of the head, and also on the back strap here there is an adjustment to adjust overhead. This is probably the most difficult part of the mask. You need to set this up properly, because if you're just kind of putting it on and just quickly putting it over the patient and trying to adjust it, comfort is huge when it comes to non-invasive. And you're dealing with a patient that's a COPDer or someone who's very high anxiety and fear. Everything is going on with them that you're gonna slap this mask on them and you tell them we're gonna help you breathe, and all of a sudden it's pushing all this pressure in their lungs, and if we can't get them to flow with the NIV, they're probably gonna get intubated, and we want to avoid intubation as much as possible. Okay, so this would be the first part of setting this up. Okay, I'll be right back. And put the mask on. So what you want to do is remove the hooks, not remove them, just disconnect them from the mask. A lot of times if you give it a little twist, they come off. Make sure you have to lay everything nice and straight so you can get it and connect it. I'm going to remove this one as well. Okay, and the first thing is we're going to be putting the headgear over the patient's head. We're not putting the mask on yet. Okay, you might need 2 people to do that. So I'm going to raise the head up, and you're communicating with the patient. Okay, sir, we're going to just put this mask on you here. It's going to help you breathe. Okay, I can actually disconnect the whole mask from this apparatus here just by hooking up the little ball holder, whatever it's called. Anyway, so take it off, that mask down. We're going to adjust the mask to patient. It's going to the 2 straps up here are going to be above the ears. So let me go ahead and remove the Velcro. And you want to do both together. You want to have nice and even pressure on each side. I'm going to lift the patient's head. There's a Velcro on the back strap. I'm going to tighten that up just a little bit. Not too tight. And of course, you're going to have to adjust the tightness and everything. So I'm pretty much ready. I have the strap up here. I'm going to go ahead and I would connect this on the patient. I'm not going to hook the BiPAP up yet, the NIV. Just want to show you how to attach the apparatus. I'm going to connect it up here. I'm going to put the bridge of the mask, the bridge of the nose, the top, and this is going to cover right underneath, and it fits right underneath the lip. I'm going to grab the holders here, snap them in place. We need to tighten them up with Velcro. That, and then I'm going to tighten this up. Probably best to tighten them up together so we're evenly distributing the pressure on the mask, on the patient's face, I should say. Okay, so let me get that. Okay. Lift his head up. Okay, there we go. We got that on there. Okay, and next we will connect the the circuit to the mask. Okay, I'm going to keep that on for now, and patient can breathe through this. And of course, if we're going to be titrating oxygen, we can titrate that over at the where the after the bacterial filter, or there's a couple ports on this mask where you can actually disconnect it and bleed in oxygen, like a oxygen tubing. You can use oxygen tubing and bleed in oxygen right there. Okay, there's 2 ports, one on each side. Okay. Give you a little close-up of this so you can see where the mask is attached at the bridge of the nose. It's up at the bridge of the nose. The nose is in there. And it's right underneath the lip, which is right there. Just right underneath the lip. Okay, and the mask is evenly placed on the patient's nose and mouth. Okay, and that's probably the most difficult part. That and trying to get the patient to, cooperate and breathe with the machine. Okay, so I'm going to go ahead and power on the NIV, the V60. The power for this, when you plug it into the wall, you have a light that tells you it's charging the batteries right now, and also that it's in, just that this is the power, that there is power to the NIV, and here's the power button. So I'm going to go ahead and turn it on. Let me show you here on the screen where is the silence. The silence up on top. We'll silence that. It's like already going. I'm going to put it in standby down here until I'm ready. I press it, and it takes about a few seconds, and it will go into standby. So right now, up on top, it's saying restart, pressure control, ventilation, because we are doing pressure control with BiPAP. We're dealing with 2 pressures, and it says, and it's waiting for patient trigger. Okay, so I'm going to go into the settings down here on the bottom. There's PCV settings. Let's go in here. PCV settings, pressure control, ventilation, and you will see a number of settings here. You have your IPAP. This is the inspiratory pressure, and you can press that and move the pressures up and down right here. Okay, we'll select 10. Accept. This one you have to press accept to take that value in, and then the EPAP is kind of like PEEP on the ventilator. We're gonna put that down to 5. We'll talk about the initial settings and all that is during lecture. Okay, and this one has eye time, it has rise time, so you can adjust eye time, and you can adjust that to patient comfort. Rise time, again, it's how quickly we're going to achieve that pressure within the eye time window. Okay, and that pressure is going to be IPAP, inspiratory positive airway pressure. Okay, you have FiO2 that you can adjust. It's a blender inside the unit that you can precisely adjust FiO2. And there's a thing here called, it's off, but it looks like a ramp. If you tap it, it is a ramp, and it's actually called ramp. And what that is, it's just how quickly, I shouldn't say how quickly, but it's it starts out at a low pressure, and instead of starting out at 10 right off the bat, the IPAP, it'll start out lower, and it will gradually come up over a period of time to the full pressure. And here it says 25 minutes. We don't use this function when we're in critical care, so we just keep it off. Okay, so this ramp is always off. You do have alarm settings on here. Once you have the patient connected, you go in, you can adjust high rate, low rate, high tidal volume, low tidal volume, high inspiratory pressure. That's kind of like your PIP, peak inspiratory pressure alarm right there. They have low inspiratory pressure, and that's kind of like if you go below the pressure here, the low, where is that, the 5, we were on EPAP of 5. If it goes below 5, it will alarm. Okay, you have low minute ventilation, you have low inspiratory pressure time. This is it can stay at a low pressure for a period of 5 seconds, and then it will alarm. We can adjust all of these parameters. We can go up a little higher, like 10 seconds, put it at 10 seconds. Low minute ventilation, again, you kind of use the same parameters when you're looking at the ventilator. Okay, so it's going to be 2 to 5 or 10 to 15% below whatever minute ventilation that we have there. Okay, you have the modes. We can do CPAP on here. We can do ST, which is spontaneous timed, which we can actually put a respiratory rate at a certain frequency, kind of like the ventilator. And batch allows you to batch PCV allows you to set up everything all at once. Okay, and here's another function here. AVAPS is kind of like a auto mode that you set a target tidal volume, a target minute ventilation, and it'll kind of adjust pressure and all that. We usually don't use that. It's most of the time we're using the batch PVC. So we'll select that, and here we can set up all the parameters, which I kind of already set up, IPAP and EPAP. Here's a backup, the respiratory rate. We can give this NIV a respiratory rate, eye time, rise time, oxygen, and we can activate it when we're ready. Okay, took in all the values at that one time. And menu, in the menu, this is where we will select the mask and loudness and brightness. But remember, the mask had that number 1 on it, and also this circuit here has this type of circuit where it's exhalation valve with the pressure line on it. So let's go in here. We can select the mask right here. This one shows a number 2. Well, we had a number 1 on that mask, so we're going to go to 1, accept. And here is a type of exhalation port, and this is the one that's called DEP, and it's got the pressure line. It shows you a picture of it, and if you scroll through them, you can see all the different ones that are in there. But DEP is the one that we generally use, so we select that, click accept, and it gives another button up here, tells you vent information, just about the ventilator, how many hours on it, software version, all that other stuff. Okay, and you have screen lock, which we're not going to lock it. We have brightness and loudness. So let's see if we have loudness. It's all the way down. Okay, and then we have the standby, which is we're already in standby right now. Okay, so I'm going to go ahead and connect this circuit here, and right now you can feel that there's air blowing through here, so it's waiting for a patient trigger. So we have a mannequin here, so we're probably not going to get much trigger, but the ventilator, the NIV, will, remember we had set a rate of 15, so 15 times a minute it's going to deliver a breath. So I'm going to connect this to the ventilator, the mask, sorry. And I'm going to go ahead and restart. And so it's currently on, it's connected. And again, the the mannequin's not going to be breathing much. We're going to be looking at the ventilator doing all the breathing, the 15 breaths a minute. Okay? You can see the mannequin actually being ventilated. If we zoom in a little closer, you can probably see that. Okay. So let's move over here to the ventilator, and I'll show you what things that we're going to see. Okay, so we have a glare, but we can probably do this. So on the ventilator, we do have alarms that have displayed, showing you that patient was disconnected. We had a high tidal volume going off and all that. So I'm going to reset the alarms. Right up on top says alarm reset. Okay, so all alarms are gone. And you have those pressure scalers. Remember the pressure scalers? You have the pressure, flow, and volume. Okay, and I guess we're getting some volume back from this mannequin, the lungs, and we're getting back about 150 tidal volume. We have a respiratory rate of 15. Here's your minute ventilation is 2.2. Here's your PIP, peak inspiratory pressure, 11. You have a patient leak. So this is the leak, which is pretty good. That's what it's talking about, is a leak around the mask, and that is in excess of what the ventilator is able to compensate for. This ventilator can compensate for up to 60 liters per minute leak, which we don't really want that. We want to keep the leak actually below 40, and we're at 32, which is good. So we have a good seal around the mask, around the face. The mask has a good seal. Okay, and so if we go, let's kind of scroll through this. Here's our pressure scaler. We can see there's pressure lines. Let me see if I can brighten this up a little bit. Go in the menu and brightness. Yeah, let's go up. That's better. Look at 5. There we go. And we're going to go back to pressure control, ventilation, the settings that are down here. This is all patient return information. So if you look at the scaler up here, pressure scaler, the top part of it is the IPAP, okay, or the rise to IPAP, and then the blue part is going to be the EPAP, which is the baseline, kind of like PEEP, okay. And then we have up here it says patient trigger. This is telling you how much the patient's triggering. Well, it's probably not triggering anything, but because of the mannequin and the lung, there is some movement, and so it's showing you how much the patient's actually trying to trigger. And so about 4%. Okay, so we have other changes down here. We have eye time. Let's go to eye time, and we can adjust eye time. It even shows you here right now your IE ratio. It's kind of 1 to 1 right now. So, oh, actually, sorry, IE ratio is 1 to 3. So we can adjust eye time. Again, if I make eye time shorter or less, in other words, it's going to go in quicker, it's going to adjust IE ratio. So I'm going to drop it down. I'm going to make eye time shorter. It's going to make E time longer. So this is how you can adjust your IE ratio with your eye time. So I'm going to go back to keep it at 1 to 3 for now. I'll accept that. And let me show you what rise time. Rise time is how quickly we get to that pressure, the IPAP pressure within that the eye time window. And there's 5 different settings, and you can see the slope now. It's going, number 1, it's the steepest, it's the highest slope. And if I start changing this to number 2, you can see the slope changing. Okay, so now we have it's going a little bit slower. So that's going to be up to patient comfort, and you're going to be asking the patient how does that feel? Does it feel like it's going in quick enough for you? Is it hard to take a breath? You're going to be communicating that. We'll leave it at 1, which is the quickest way to get the air up to that pressure. We'll accept that. So these are pretty much the settings we start out initially with: IPAP of 10, EPAP of 5, and we will discuss more about this during lecture and the different things about non-invasive mechanical ventilation. So real quick, we're going to stop NIV, and the way you do that, the first thing you're going to do is you go to standby, tap it, and it's going to tell you remove mask or disconnect the circuit. So I'm going to reach over, disconnect the circuit, and it just went into standby. Okay, so we can leave it like this until we're ready to reconnect it, if it's going to be a short time. But if we're done using the ventilator, then what we can do is, after we go into standby mode, we basically just come down here to the power. You press it, it'll display ventilator shutdown, and we'll click that and it'll automatically stop. Okay, so that is how we stop the NIV.